kidney stones. Just hearing those words might send a chill down your spine. If you've ever experienced them, you know the excruciating pain they cause. But what if I told you that your body often sends warning signs up to 30 days before you experience the full-blown agony of kidney stones? Most people ignore these early signs, but in today's video, I'll reveal the subtle clues your body gives you and why it's crucial to act fast. Don't wait until the pain becomes unbearable. Before we dive in, let me know in the comments where you're watching from. I'd love to give you a shout out in our next video. Now, let's get started, because this information might just save you from a world of pain. What are kidney stones? To understand the signs, let's first break down what kidney stones are. Kidney stones, or renal calculi, are hard deposits made of minerals and salts that form inside your kidneys. They can be as small as a grain of sand or as large as a golf ball, and their formation happens when your urine contains more crystal-forming substances, like calcium, oxalate, and uric acid, than the fluid in your urine can dilute. In simple terms, kidney stones are like a buildup of tiny crystals that turn into bigger and bigger lumps inside your kidneys. When these stones move around or try to pass through your urinary tract, that's when the pain kicks in, and trust me, it's often described as one of the worst pains a person can feel. The real danger lies in not recognizing the early symptoms, which can delay treatment. So, what are these subtle signs you should watch out for up to 30 days before a kidney stone attack? The early signs, 30 days before symptoms. 1. Frequent urination or urgency. One of the earliest signs you might be dealing with kidney stones is frequent urination or a sudden urgency to pee. Now, this is tricky because many people attribute this to drinking more fluids or even a bladder infection. However, if you find yourself running to the bathroom more often than usual without a clear reason, it might be your body signaling that something isn't right in your kidneys. The reason? When stones begin to form, they can block or partially obstruct the flow of urine, leading your bladder to feel fuller than it really is. The sensation of urgency might become more frequent, and that's your first clue. 2. Cloudy or foul-smelling urine. Have you ever noticed that your urine looks a little off? Healthy urine is usually clear or light yellow, but when you start developing kidney stones, it can become cloudy, foamy, or even foul-smelling. This happens because the stone formation can cause an infection or irritation in your urinary tract. Infections, even mild ones, can trigger this change in your urine's appearance and smell. While cloudy urine can be linked to dehydration or other issues, it's a red flag you should never ignore if it's persistent, especially when paired with other signs. 3. Blood in the urine, hematuria. Blood in your urine is one of the most alarming symptoms you may encounter, but it often happens much earlier than the actual onset of pain. The medical term for blood in the urine is hematuria. This can occur when the kidney stone moves within your kidneys or along the urinary tract, causing irritation to the lining. While the blood may be noticeable to the naked eye, it can also be microscopic, only detected through a urine test. If you see any sign of blood in your urine, even if there's no pain yet, consult a doctor immediately. It's a major warning that your kidneys are in distress. 4. Back pain or flank pain that comes and goes. Here's where things get a little tricky. Early back pain or discomfort near your ribs, often called flank pain, is a major sign that kidney stones are developing. This pain is usually mild and comes and goes in waves. Many people mistake this for muscle strain or other less serious conditions, but don't be fooled. Flank pain is often one of the first physical symptoms that a stone is starting to move or grow. Keep in mind that this pain may not be severe initially, but it's your body's way of telling you something's wrong before the pain escalates to the unbearable level that kidney stones are known for. 5. Nausea and vomiting. Believe it or not, kidney stones can make you feel sick to your stomach even before the actual pain kicks in. The reason is that the kidneys are closely connected to the digestive system through shared nerve pathways. When a stone begins to irritate the kidney, it can trigger nausea or vomiting. Many people think they're coming down with a stomach bug when, in reality, it's their kidneys acting up. If you notice frequent nausea or episodes of vomiting without any clear explanation, and especially if paired with some of the other symptoms we've discussed, don't ignore it. 6. Changes in urine color. We've already talked about cloudy or foul-smelling urine, but another sign to watch out for is a change in color. While the ideal urine color is pale yellow, the presence of kidney stones can make it darker or even give it a reddish or brownish tint. This happens because stones can cause bleeding, as we mentioned earlier, but also because they may reduce urine flow, concentrating it and changing its color. Any noticeable shift in the color of your urine, especially if it's accompanied by other symptoms, is a reason to seek medical advice right away. 7. Trouble sitting or staying still. As kidney stones begin to form, some people experience discomfort or difficulty sitting still. You might find yourself fidgeting more often or having difficulty finding a comfortable position. This discomfort typically originates from the kidney area and radiates outward, making it hard to sit for long periods without feeling some kind of internal agitation. This is an often overlooked sign, but one that many kidney stone patients report experiencing weeks before the full-blown symptoms appear. 8. Mild fever and chills. One of the lesser-known early symptoms of kidney stones is a mild fever or chills. This is usually a sign that the stone is causing an infection in your urinary tract. Infections associated with kidney stones can quickly escalate into serious complications if left untreated. If you've been running a low-grade fever for a while and can't seem to pinpoint a reason, it's worth considering that it could be kidney-related, especially if other symptoms are present. Why you should act early. Now that you're aware of the early signs, it's crucial to understand why acting early makes such a difference. Kidney stones don't usually get better on their own. In fact, they only get worse if left untreated. Once you start experiencing severe pain, it may be too late to avoid invasive treatments. Some kidney stones are small enough to pass naturally, but others may require surgery or other medical interventions. The earlier you catch them, the more options you have for non-invasive treatments, such as medications or dietary changes that can help dissolve or prevent stones from growing larger. Preventing kidney stones, what you can do now. The best way to avoid the pain of kidney stones is to prevent them from forming in the first place. Here are some key lifestyle changes you can make to reduce your risk. 1. Stay hydrated. One of the biggest risk factors for kidney stones is dehydration. When your urine becomes too concentrated, it's easier for minerals to crystallize and form stones. Drinking enough water throughout the day is essential. Aim for at least 8 glasses a day, and more if you live in a hot climate or are physically active. 2. Watch your diet. Certain foods can increase the likelihood of kidney stone formation. Reducing your intake of foods high in oxalates, like spinach, beets, and nuts, and sodium can help. At the same time, increasing your consumption of calcium-rich foods, like leafy greens and dairy, can prevent the body from absorbing too much oxalate. 3. Limit salt and animal protein. Too much salt and animal protein, like red meat and shellfish, can increase the risk of certain types of stones, particularly uric acid stones. Reducing your intake of these foods can make a big difference. 4. Take medications as directed. If your doctor prescribes medications to prevent kidney stones, make sure to take them exactly as directed. These medications are often designed to balance the minerals in your urine, preventing new stones from forming. The importance of seeking medical advice. If you've noticed any of the symptoms we've discussed today, don't wait. Kidney stones can quickly progress from mildly uncomfortable to a full-blown medical emergency. The best thing you can do is seek medical advice as soon as you notice something unusual. Your doctor can perform simple tests, like a urine analysis or an ultrasound, to determine whether kidney stones are forming and recommend the best course of action to prevent them from getting worse. So there you have it, the signs your body could be sending you up to 30 days before you experience the painful symptoms of kidney stones. The key takeaway here is that you don't have to wait until the pain becomes unbearable. By recognizing these early signs, you can act quickly, seek medical advice, and potentially avoid the worst of it. Let me know in the comments if you've ever experienced any of these symptoms and where you're watching from. I'd love to give you a shout out in the next video. And, of course, if you found this information helpful, don't forget to like this video, subscribe,